Welcome back. We're talking about rising case numbers, new fines for large gatherings, outbreaks at schools, the battle against COVID-19 ramping up once again after what often felt like a stress-free summer. It felt like a bit of an escape, didn't it? Well, did the experts see this coming? We're going to check in with one of them. I'm joined now by Dr. Colin Furness, infection control epidemiologist and assistant professor with the Faculty of Information at U of T. Good morning to you.
Good morning.
So let's start with the announcement yesterday from the province, regionalized, looking to Toronto, Ottawa, Peel region, where we've seen the hot spots. I want to get your take on the limiting of these social gathering numbers and whether or not you think this is going to be adhered to and effective.
It was the right decision to make. It actually probably should have been baked into the plan from the beginning. When we open schools, there's certain things that we're going to have to dial back. And so for individuals, I think the overriding concern here is how small can you make your bubble? Can you shrink that bubble down? We got away with a lot of things during the hot summer weather, but it's not that anymore. And with the onset of cold weather, the onset of winter, everything gets more risky. So I think it was the right move. Whether people will adhere to it, well, you know, it's public messaging is really important. And I hate to say it, but fear matters. And as case counts go up and people get a bit more afraid, that tends to drive compliance a bit higher too.
Dr. Furness, do you think that this should have been extended to other regions as well, not just these specific hotspots?
I like the idea of varying the restrictions according to local needs. At the beginning, if you remember, the Premier's office said that they needed to control everything and the whole province was going to move on one timetable for everything. And that's pretty unfair to places that don't have a lot of COVID. So I think devolving it to specific regions to say, here's where we have trouble, here's where we have risk, this is what we need to do here, I think that makes sense.
We are seeing a number of COVID cases at schools across the province. Do you foresee changes to be happening within school protocol, within class sizes, anything? Because these numbers, it seems like they're going to be on track to continue to climb.
Well, with something like 2 million kids going back to school and about 170,000 teachers teaching them, those numbers tell you that there's COVID. There's COVID in those populations. That's a lot of people. I don't think schools are going to be drivers of infection. I think they are going to reflect what's going on in the community. So if there's low community spread, I think the schools will look fine. And where there's more cases in the community, you'll see issues in schools. The overall plan looks good. I'm obviously disappointed by the fact that some class sizes have turned out to be quite large. I think the province should have committed earlier on to say, let's make sure we have more teachers, let's err on the side of caution. They didn't do that. I'm also concerned that the amount of money and the amount of time allocated to deal with ventilation issues has been really inadequate. So I think there's still work to be done to try and shrink some class sizes, and particularly to do interventions with ventilation. That needs doing, and that needs doing quite urgently in some schools. So that I think is important. Do the protocols need to change? They're already pretty good overall, although I know mistakes will be made in a system as big as it is, and we'll learn from those mistakes.
Finally, for you, we are monitoring these lineups at various assessment centers. We know the province has upped their testing capacity, they've said. What do you make of all of this? Are people being tested as they're asymptomatic? Do you think that there's an overreaction? Do you think, I mean, I just want to get your take overall in general, because obviously we've got a problem right now.
Yes, the hours for assessment centers got slowly and quietly rolled back as there seemed to be less need for them. But I think anyone looking at the situation critically would have been able to anticipate that come the fall, when cases go up, because I think everyone understands that that was going to happen. I don't think that's a surprise at all, that people are going to be concerned and people are going to want to get tested. And what you really need to do is make testing easy. You need to make it accessible. You need to make it easy. We should be doing mobile testing. We should be expanding our testing capacity substantially. And that's something that I haven't heard that we've been working on. So it is concerning, no question, but more testing is always going to be better.
Okay, Dr. Furness, you're going to stand by for us for our You Sound Off, which will be in about 15 minutes' time. You can call in. You can also email us if you have a question for Dr. Furness, and we'll hope to answer as many as we can. Thank you for that. We'll talk to you very shortly.